The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha and welcome to Be Fit for Health. This is Bianca, your host. It's another great day to celebrate our health and wellness, and it is the end of the year, beginning of a new year, and we're just really excited because, we made it through 2020, and wow, what a ride we had. And I know a lot of us have had some, issues physically because we stayed home. We weren't moving around as much. We were stressed out. We ate a lot of food that we probably shouldn't have and put on some weight, of course, got a little off balance. And, there are places that we can go and experts we can talk to get us back on track. And today is no exception. I'm very lucky and blessed to have this special doctor on our show. In fact, he is someone who's been around for quite a bit of time. He has his doctorate degree in chiropractic, and he is someone who's been doing this for about 26 years here in Hawaii. I mean, that's quite a bit of time to be, manipulating and adjusting and balancing people's bodies, and I think that's pretty exceptional. He's got about 100 hours of pediatric chiropractic too, which is really interesting because you never think about a baby having to be adjusted, but they do, because think about it, when they come out of the birthing canal, they're squished and they're moved and their bones are soft and everything is pliable. But there is things that could happen during birthing that babies could need supported. And that's where scoliosis sometimes can happen. And you never know. And going to a doctor, like this special doctor that I'm going to name in a second is the way to go, because as you grow up, your body is not needing more adjustments. Dr. Armando Garza is an amazing chiropractor. I'm very blessed to have found him. He was referred to me by a friend of mine who's a fellow trainer. And me with my fibromyalgia, the pains, discomforts that I suffer, my neck, I've got arthritis in, my lower back, I've got degenerative disc issues with some calcifications and bone spurs. And so that flares up a lot. And I've been looking for a chiropractor that I can go see that can not only do chiropractic work, but also he does a total body modification, which is a specific technique that allows the body to communicate better, not only with the muscles, but also with the organs, the brains, and other areas of the body that needs to be communicating. And this is the problem that I've been talking about, is that my body stopped communicating properly. And this is why I'm having this disconnect. And I'm trying really hard with different modalities to connect the system. And I'm very, very happy to have met Dr. Garza. Welcome to the show, sir. Are you there?
I sure am.
Oh, wonderful.
Bianca,
yes.
Great being on.
Well, I appreciate you because I know you're super busy and you're squeezing me in your schedule. And you know what? This is to educate everybody. And I appreciate you taking the time to talk to my audience, because I know what you're doing. Although it's chiropractic, you have some other specialties that are a part of your wellness clinic that you have here in Lihiha Street. And I know that a lot of people come to you, but there's still people that don't know you exist. So let's talk about what you do at your clinic.
Well, of course, so we do the basic chiropractic as well, but I did hear you talk a little bit about, some techniques that I do as well. And so, such as the total body modification, you talk about the body communicating more effectively from the brain to the body. And, because everything runs on the nervous system.
Right.
In the Gray's Anatomy book, it says that the nervous system is the master system. It regulates every cell, tissue, and organ, and so it has to be communicating effectively. And, that nervous system comes right from the brain through the spinal cord and out. And the areas that get the most interference, obviously, is right there at those joints of the spinal column.
Yeah.
And some amazing things can begin to happen. And so when people do come in for pain and things like that, I always tell them the pain isn't the problem. The pain is just your body's alarm system going off saying something is wrong. And that's my job, actually, Bianca, is to find out what that something is.
Yeah.
And it could be something, structurally as well as neurologically.
Yeah.
And that's my job.
Yeah, I mean, people don't realize that, the nervous system, gosh, that's like our reporters, they're in our body. They go and they report to different areas and they send it back to the CEO of the newscasting department and say, hey, this is what's happening here. What do we do?
And especially during this COVID time, people are so concerned about, catching it and stuff. But, even Jonas Salk, the guy who came up with the vaccine for polio, supposedly, later on in life, he actually realized it wasn't the seed, but the host that was the problem.
Yeah.
And so, meaning that our bodies has this amazing ability to heal and to really, when it's affected by a virus or a bacteria, to really adapt to it, fight it off, create an antibody for it, and everything, So it's really, as I say, the nervous system is your immune system, and your immune system is your nervous system, and they work just hand in hand. It's one and the same.
It's so funny.
If that nervous system is... go ahead. I'm sorry. Go ahead.
No, I was going to say, you're one of many doctors that I've had come on the show that says the same thing, that although the viruses and bacteria are nasty, they're also can be, we can overcome it. I mean, the fact that our body is that resilient, I don't think people realize that, or they're not confident that their body can combat a lot of these little, microbes that try to affect us.
Exactly.
That's crazy.
I mean, that's exactly right. And that's really the whole thing, is if your body is functioning as best that it can, that's why in a classroom, say for instance, you get a kid that comes in with a cold, why do some kids catch it and others don't, it's because of their compromised immune systems. And so, because all the kids are exposed to the same kids,
right.
But yeah,
it's
same
different.
thing.
So you're basically in your clinic though. I had this experience, and I'm glad I got to see you before we had this interview, because it kind of gave me an idea of what you do with your new patients. Yes. I mean, you really do a thorough assessment. I mean, you do ask a lot of questions, and you try to understand the person, because it's like, if you don't know me from Adam, I mean, you just met me, so you're trying to figure out in my whole 50 years of life how I messed up my balance, what happened. And it doesn't have to necessarily be genetics. It can be a partial genetics, but you looked at the structural integrity of my body. You looked at the anatomy of my body. You looked at the nervous system as well by doing certain tests. And then you made an assessment on how to adjust me for the first time, because I'm a little bit more of a special case, having overactive nervous system. You could overstimulate me and I could have a negative response. So you're an experienced chiropractor enough to be able to teach others out there how to adjust people like me, because we get scared to come to doctors like you because we don't want to be in pain again, right? But, you adjusted me gently but yet effectively, and I appreciate that. And this was just our first session, so I can't wait till the next time you get to adjust me again. That'd be great.
Fantastic, yeah. Because I've had other people just like you that have that. In fact, I remember one gal I had who I just barely touch her neck, and she would go into almost like an epileptic seizure. So we had to kind of work around that. Yeah, and but we were able to do some amazing things with her, and she hasn't had that problem for a long time now.
Well,
so
how do you
pretty
adjust?
Cool how the nervous system works.
Yeah, but how do you adjust someone that you can't touch? What do you do? Do you go to other parts of the body, or?
Yeah, you're going to have to. I mean, I have to, obviously, because if you touch that one part that's acting up, then you just got to find that secondary area. What's going on. And there's other ways that I can do it as well, using, like we were talking about earlier, is this energy thing or this muscle response test that I do. And so I guess some people call it kinesiology, but using the total body modification that you mentioned, that technique, I've been able to really just do some pretty cool things. And again, helping the body to start communicating a little better. And I may not be able to touch that place, that causes the problems. But once you start to, again, connect something else from the brain to certain parts of the body, then it can start the healing. I kind of look at it this way. Sometimes from my office to your office, wherever you're at it, there's probably 30, 40, 50 different ways to get there, but there's one main road.
Right.
And sometimes that main road may have a detour because a water main broke, so
or they're
you just
paving
have
the
to
road.
find the other. Yeah, exactly. So I just have to find the other route, and the body actually finds it, but I kind of help it along, and it'll start to find that other detour. And that's what we call creating new neural pathways sometimes, right?
Yes.
You've probably heard of that.
Yeah, for as a trainer, that's what we work on as neuro pathways, is creating those new ones so that the body can actually become more resilient again.
Exactly.
So your testing, though, the total body modification that you do reminds me of an orthopedic testing that you do, or the neurologists do when they try to test you, like for strength and stuff. It's not exact, but it's similar, where they try to see if the lumbar vertebrae are having, if there's a herniated disc, they make you, go on your heel to see if you can go on the heel, or things like that. So these aren't new techniques. It's just more specified for knowing a little bit more about what's happening in the communication factor, that what you're doing with the total body modification. So I thought that was really interesting.
Right. Yeah. But there is kind of a difference, because when we do, because we learn the same neurological and orthopedic tests that I utilize as well as some of the other neurologists or orthopedic will use as well. We do the same tests. We learned all of those, same tests that they do. So those are more muscle strength tests. And there are some also neurological tests as well. But the test that I do is more what I call a muscle response test. I'm not looking to see who's stronger. I'm looking to see if there's a change in the strength of it. And I mean, I know it sounds like a mincing of words there, but it has to do really with the neurological aspect of that one. Oh, they're all going to be neurological aspects. I guess it's kind of hard to explain. But remember when I did the round ligament on you?
Yeah.
Remember I just pushed on that one certain area,
right?
And then I pushed on it. I was just using my finger. I wasn't seeing who's stronger. I was just seeing if there was going to be a response, and there was, remember?
Yes.
And then when we fixed it, the way we fixed it, and then when I rechecked it, it was strong, right? The muscle test again.
Yes.
So
it falls into as Chinese medicine too. I want to remind people too, because people may not understand this. They may be able to understand the meridians and how if you do acupuncture in one spot, it also affects the other spots in the body. It's similar energy wise. So you're not doing something that's like hocus pocus. You're actually doing things science based.
Yeah. Yeah, no, this is very scientific. In fact, it's amazing. Whenever I share with people, we're made up of trillions of cells, or who knows exactly, but just say trillions of cells. And in each cell, you have, of course, like the mitochondria, right, where our energy is made. You have Golgi apparatus and all these other things. But in there, you have a nucleus and a nucleolus. And, that's where our DNA and all that. But in there, you have a positive, a negative, and a neutral charge. It's called a proton, a neutron, and an electron.
Right.
So that's all electricity is. It's just electrons flowing through the wires, right? And so really, we are electrical beings.
Yep.
And so whenever there's something going on, we're really checking the electrical system of our bodies when we're doing that muscle testing and things. So it's pretty awesome how that all works, though.
So does chiropractic, and this is going to be probably a silly question, but it does make sense to me. But so if I'm not having a positive response electrically, and you go and you make an adjustment, and you're allowing that space to now have a little bit more room, how long does it take before that nerve that's been crunched up and pinched for, let's say, years, how long does it take for that nerve to get back and regenerate itself to a level where it's not so damaged?
Right. That's a great question, actually, because, you hear about sometimes that nerves don't regenerate.
Right.
Your cells and tissues and ligaments and tendons and muscles, they all do, and bones, they all regenerate except for the nerves, right? That's what we hear all the time.
Right.
So it depends. That's actually a great question. However, not to shy away from it by no means, but there really is no answer. It's an answer I can't answer, to be honest with you, in an honest way, and say, oh yeah, it's going to take so many weeks or so many months. Everybody's different, but the longer it stays damaged, the longer it takes to heal and come back. So
I would think that there would be something that we could ingest or take that would help along with the chiropractic, because, obviously you're not going to fix me in one session. I have a feeling we're going to have a long-term relationship here when it comes to you working on my body, because it's going to take you adjusting, my body adjusting back to where it was before, and you trying to recreate this pattern that you were talking about. Now, I know that I have crunched up nerves because I have muscle tissue that has been, I think, like solid rock for at least 2 decades in my shoulders. So and that's just to protect my spine, right? The muscles are there to support the spine column. So I mean, I don't know. I'm just trying to figure this out because I know there's a lot of people here that do construction. They do all sorts of physical labor, and they're probably as messed up as I am muscularly, maybe not as neurologically. But yeah, I mean, this is why people come to chiropractors to get that relief.
Right. Well, when you talk about time, I'll just give you one example, and that was my front desk girl that I had. She was my front desk girl for about a year, but she fell in love and moved to the mainland this past April. But when she first came to see me, she had been a patient of mine for probably not quite a year, and I would just adjust her once every so often. And what her case in a nutshell was for, well, she was a nurse for one thing. She had been a nurse, a registered nurse, and for almost 6 years, it was about 5.5 years, she couldn't work because of autoimmune disorders like fibromyalgia and a few other things. And she could not work. And if she did any activity longer than maybe 10 or 15 minutes, it would wipe her out for a day or two.
Yeah.
She was on multiple opioids a day, including morphine. And so her life was pretty much living on the couch and the bed. And that was a sad, testament to what was going on with her. So her nerves, you talk about a neurological, mess here. That's just what it was. And so, finally I says, we got to get, serious with this, and so we did. I made a plan out for her because she wasn't ready at the time. But when she finally says, okay, and we started working on her, well, after about a month, she started to cook, and she loves cooking. And I'd say probably within about 7 months or so, 8 months, she started working for me full time. And she never wanted to be in a relationship because, she didn't want somebody to live this life with her,
I can relate.
And yeah, exactly,
It's not
and
fun.
So here so she met this guy, and now she's there. She was working full time for me, whereas before she couldn't do anything, nothing. I mean, for 10 or 15 minutes, and it'll wipe her out for a day.
Yeah, she
only
mentioned
on
that to me. She was very happy and grateful to you, by the way. She seemed like she was just feel like a new person.
Yeah, exactly. So, yeah. And so amazing how the body can regenerate itself. But again, it depends on the person. For her, it took about 7-8 months. But, here she is living a full life now with hardly, every once in a while she has to take maybe an opioid every once in a while because she still has a few autoimmune things going on, but nothing what it was. So.
No, it's when you can find something that works. Oh my God, it's heaven sent. It's just wonderful because the pain and the discomfort that we go through on a daily basis is just horrific sometimes. But I would say that it's made me a more educated person and more sympathetic to others who are going through minor things. But because I know that those even minor things to those people might be major, and I don't think anyone would want to live in a body that's always constantly in this turmoil. But I do know that with the neck, especially because she was mentioning something to me yesterday, and she said that she has a straight neck, and so do I. I don't have a curve in my cervical vertebrae. And that happened, I think, because I have a long neck from what some doctors were telling me. Can you fix that? Can you make a curve back in the cervical that is straight, or is that permanent?
Yeah, well, it's, again, great question, but, to be honest, it's going to be kind of hard to really reintroduce a curve back into the system.
Yeah.
Now, I'm not saying it's not impossible.
It depends on the person.
That would be, that is a commitment to try and get that working again. And, on both parts, my part as well as the person's part to do their part in all of this, because it's not a passive thing where you just come in and I adjust you all the time, So there's things you're going to have to do at home and all of that. But again, your body's trying to protect itself, and the muscles start getting tight, and then it affects that curve. And so, but that's the sad part. If that curve is left, the loss of the curve, if that loss of the curve stays too long, it'll start to become permanent in some ways. But unfortunately, when that happens, it starts to accelerate the degeneration process even more.
Unfortunately, that's what I'm dealing with. But is when that happens, though, what is in your doctor's experience and expertise, what is the long-term effects of something like that? I mean, like, if someone has a straight cervical and they are already starting to have degenerative disc and maybe slight bulging discs here and there because of, the shifting of the vertebrae, what happens if someone, does they have to get a fused neck to support or what happens?
No, not necessarily. It's just going to be, we just tend to have more neck pain, probably more headaches, things like that. But I have a lot of people that have loss of the cervical curve as well, and they live full lives. Sometimes even no symptoms at all.
Lucky people if they do. That's wonderful.
Yeah. Now that doesn't mean things aren't happening there, obviously, because remember I did say though that the loss of a curve does accelerate the degeneration process. But for some, they don't have any symptoms whatsoever, which is kind of interesting, isn't it?
Yeah, no kidding. I mean, I'm just amazed at how our bodies can do what it does and then still go on like as if there's nothing happening internally. I mean, I have Phenomenal. A lot of bone spurs and calcification in the MRIs that I've done. It showed a lot of them in my spine, and that tells me that my body is working hard to support its structure and trying to calcify areas to make it like solid pieces in order for it not to move. And that's crazy. But as a chiropractor, can you work with those as well? The bone spurs and the calcifications? Is it going to make it harder for you to adjust the spine?
It just depends. I mean, there's a disease called ankylosing spondylitis, for instance, where it literally somebody's whole vertebral column will fuse, or at least some of the areas. And for some people, the severe ones, almost all of it will be fused together. And once that happens, that's kind of a sad, outcome with that, though, unfortunately. And I do have a few patients that have that, but again, it helps them at least some relief. But yes, if it's that kind of a thing, that's a different story. But when people have, like you do, you have arthritis it's associated with these bone spurs in there. And it depends on where those bone spurs are. If it's putting pressure on a nerve, that's a whole new ball game, unfortunately.
Yeah.
But if it's sticking out in other places, it's still causing some problems. Now, it does start to fuse together. There's certain phases of degeneration, and once it gets to that third phase and stuff where it can actually fuse together, even on an X-ray, it may look like it is, but there's actually still some movement available that I've been able to see. So I have people in phase 3 degeneration, and what I do helps them. So
what about dehydrated disc? Can you help with that?
Great question. Well, that's not really. I mean, that's where personal responsibility comes in to either do more water and things like that. Because obviously, that's kind of not a right term in some ways, although they call it that. But it's still bathed in certain areas, with fluids and stuff. But you're right. Once that degeneration of the disc starts to happen, that really starts a whole new ball game of degeneration as well.
Yeah, so, I think I'm starting to get a dehydrated disc on my L5-S1. So it's they're saying that once it's dehydrated, it's hard to hydrate it back unless you I guess, I don't know. I mean, unless they go in there and put stem cell or something. I don't know.
Well, and through movement, because even though it's an enclosed system, you need movement in there to act like an accordion, to allow things to go out and things to come in. And so you do that through walking and, like you do exercises. Now, again, I know you do it, but you got other things going on that are making that difficult.
Right.
Yeah. So.
Yeah. I mean, like I was telling you yesterday, and the audience knows, when I do too much of a workout, like let's say I feel good that day and I push it a bit longer than I should, the internal tremors that I get, it's like neuropathy internally that I can't really stop until the nerves calm down, because the nerves have gotten so stimulated. It's just, it takes a little bit of time before it really calms down. It's like taking too much caffeine and you've got the jitters, but that's just natural. I'm so lucky.
Yeah. Yeah. Kicking in that sympathetic nervous system, right?
Yeah. So chiropractic can help with calming the sympathetic nervous system, can it not?
It just depends. Yes, there's some techniques I do that will do that, and so one of the things I see, especially with people that happens to a lot, where the sympathetic is just, and that's called the fight or flight, right?
Right.
And that usually happens when people are under a lot of stress, unfortunately, and that's really sad because, in fact, there's a great study done by a Dr. Hans Selye, Selye. If you ever look at that study, it's an amazing study, and he shows this whole thing where it starts, and then he just works it down to this algorithm of all this sequela of what can happen. And that's why, even to the point where it causes us cardiovascular problems and heart attacks and things like that. So, yes, an adjustment can help with that, to help bring that down. One of the things, a response that I get from a lot of patients sometimes, especially new ones, is after they did an adjustment, they went home and they said they slept for like hours,
Well,
and I tell them, I said, that's perfect,
You did the same thing to me, though. I got to tell you, you didn't really adjust me much. You just did my thoracic and did a little bit of my C1.
The Atlas, yes.
I went home and I was exhausted. It wasn't the bad exhausted. It was more like I could close my eyes and go to sleep and just take take a deep sleep. And I did sleep well last night, I got to tell you. So I don't know, what was that? Was it?
Yeah, fantastic. So what that is that's, so, like when your body needs salt, it craves potato chips, right?
Right.
Or something, whatever. It craves something salty because your body needs salt. Now, the thing is, though, is healing takes place in the parasympathetic system, right? And you heal when, especially at your deep sleep, in the REM sleep. And so what happens is when your body says, when I did the adjustment, it finally said, oh, man, okay, now I can relax. Now I can heal. And it puts you down, and then your body will start to heal more effectively. So I didn't realize that happened to you. That's the first time you told me. So, wow, that's pretty cool. Yeah, and that's why you felt that way.
Yeah, it was 2 hours after the adjustment. All of a sudden, was it 2 hours or an hour after the adjustment? I came home, and I was like, wow, I'm exhausted. I can go to sleep right now. I wasn't hungry. Yeah. My appetite wasn't there because I think my body was in the focus of healing. I think the body was trying to reserve that energy from digestion to healing.
That's exactly what was happening to your body. Was your body knows when it can heal, and it happens when you're sleeping, and so that's what it was doing. It was putting you at rest, so that now that the nervous system is functioning and communicating, now it can heal that part of the body.
God,
and so it puts you down to sleep. Yeah.
Hey, Doc,
I didn't even know that happened.
I know.
Thanks for sharing that.
Trust me, I'll give you more feedback if there was more. I'm not one shy of sending text messages to doctors and letting them know. They're like, thanks, Bianca. Yeah, okay, it's like Sunday. Do you mind? I have no filter. Yeah. So, Doc, we're going to take a quick 15-second break, but when we come back, I kind of want to talk to you about some of the benefits that chiropractic does for our patients. We were talking about that. I want to talk about the vagal nerve because that seems to be a big problem for a lot of people, and they may not even know it. And we can talk about what chiropractic can do with that. Okay, so hold on tight. We'll be right back.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit BeFit4Health.com for more.
Hello, we're back with Dr. Armando Garza. He is, in fact, a seasoned veteran chiropractor. I can't even talk. I'm thinking about all the stuff we've been talking about still in my head. But he is a chiropractor here in Hawaii for the past 26 years. He's over in Iolani area. His company is called Garza Wellness Care Center. And, in fact, he is my chiropractor. I went to see him yesterday, and we were just talking about how I wanted to go sleepy right after my treatment. And he was explaining to me why that was happening. And I'm like, yes, this is beautiful because Dr. Garza, I'm telling you, if I can just get that response every time, that will make me feel good knowing that I'm in the process and path of healing. And that's where my neck has been cramping for the past 2 months. And that cramping has been causing me to have stomach pain, which I thought was actual digestive issues. When I did the test with the barium, I had to drink it. And they did an x-ray or MRI, whatever it is, along the way of 2 hours. They had to see how fast the food traveled. They didn't see any obstruction. They didn't see any issues. So obviously it's not digestive. So this is neurological. And I told this to my neurologist. So chiropractic and the adjustments that we're making with especially C1, C2, the vagal nervous system is not my friend right now. So how can we make this my buddy?
Well, actually, he is your friend, but your body's not treating it right now. So, so the vagus nerve actually comes off of the brainstem area, right? It's part of the cranial nerves, right? There's 12 cranial nerves. Now, what it does is C1 sits just below the skull, right? That's why they call it the atlas. Remember the old atlas holding up the globe, right? We remember that, right? So our atlas holds up our skull there. Or I'm sorry, Atlas holds up the world, the globe, right? So
I'm agreeing with you, but yes.
Atlas. Now, so what happens is the vagus nerve comes down, and then it comes out with the C1 nerve. So just right there. And so when that C1 vertebrae shifts out of position, it affects the vagus nerve. Now, the vagus nerve, that's why you were getting those problems. Remember, you have branches up into the head area.
Right.
It's the longest nerve in the body, and it goes, you have branches again into the head area, into your lungs, your heart, and even way down into the gut. And it's actually even synonymous. You can even say the parasympathetic is the vagus system and the vagal system. In fact, they use it sometimes simultaneously. When they talk about the parasympathetic system, sometimes they'll call it the vagus system or the vagal system. Sometimes that's how intimately it is with the parasympathetic. So so when we adjust that C1, oh my goodness. I'll give you, for instance, I had a baby who was 7 weeks old, and they thought, this poor little girl was just crying. And she was having all kinds of stomach issues and all kinds of things. And they said it was colic and all this kind of stuff. But and when I say crying, I mean this, when a baby cries, like when they have a dirty diaper or they're hungry, you can kind of, okay, they're crying. But whenever you hear a baby crying in pain, which I've had many come in here,
that's terrible.
It's a whole different ballgame because they can't verbalize it. That's how they're verbalizing it, is through pain. And I'll just use this one baby, for instance. To make a long story short, this couple was just distraught because of this baby. And I'm talking, she would maybe rest for maybe 15, 20 minutes, wake up again, and just cry. And it was so sad. But I checked her C1, and sure enough, it was so far out of position. It was not funny. They had done a C-section. And they had pushed on her head so hard that she actually had this big red hematoma on her head from the push.
What is going on? What are
these
guys doing?
Yeah. Well, they just trying to get baby out, but it had jammed up her C1 so bad. And I remember when I had adjusted her, and I just use my little pinky. I don't adjust them like an adult, and I just push a little tiny push on it. And I remember when I did that, I said, okay, that's it. And they said, that's it? And I said, yeah. And to make a long story short, what they did was I went home. I called them up that night to see how baby was doing. And kind of sarcastically, she said, well, she's still crying. I said, okay, well, just let it do its thing. Well, 2 days later, she came in. She says, I don't know what you did, but I'll tell you what, that night you called, right after you called, about 20 minutes later, she went to sleep for about 12 or 14 hours and didn't wake up.
That would panic me too, though, because I'd be like, why is my baby sleeping so long?
And it did her too, thinking, what did that doctor do?
Oh, no.
But it turned out well. And after that, the baby has just been amazing. And we got a follow-up, and she's like 20 now, I think, and just doing amazing still. So
the birthing can can mess up the spinal column itself just because of the way that it was either pulled out or I mean, so how many babies go ahead.
No, it's just because one of the things that they do, OBGYN does when a baby comes out, they call it the figure eight. So the head comes out first, right?
Yeah.
And of course they're going to pull on the neck, and then they're going to turn the neck to the left to get the one shoulder out, and then turn it to the right. They call it the figure eight move. And boy, I'll tell you, when they pull too hard, they kind of shift that C1 out. And but I with the babies that I do check, I probably only do have to adjust maybe about 50-60% of them.
Okay.
So yeah, so my pediatric training is not just in babies; it's also in the pregnant woman itself too. Yeah. So
You adjust pregnant women? Oh, you adjust the
oh
mom,
gosh,
but not the baby, obviously.
yeah,
Because how
yeah,
can you
yeah.
get
That's
the
the
baby?
moms.
I'm sorry, I just had a
Well,
visual.
I'll
I'm
tell
like,
you.
how's that work?
Well, I think yeah. How do I go through that? Right. No, in fact, I'll tell you what. I just had a mother give birth on what's today? Saturday. She gave. Oh, what's the 19th? The 19th was
Yeah,
Saturday.
Saturday. Yeah.
Uh, yeah, but about a week and a half prior to that, the baby was breached. And
Ooh.
so she contacted me because the doctor, her OBGYN, who's really, a little bit more for alternative, said, "Oh, do you know a good chiropractor at least?" Because they wanted to do all kinds of, they were going to do a C-section.
Right.
And there's a technique actually called the Webster breach technique.
Mm.
And I told her, I says, "Well, this is a little late in the game, but we'll try." And so we got 3 adjustments in. And I'll tell you what, on Thursday, she calls me up and she's crying, and I thought, oh gosh, what's happened, And she says, "Doc, it's baby turn. She's head down now." And I'm like, oh man, how cool is that?
Oh, that's
And she had a natural birth on Saturday. So,
wow, that's amazing. God, you're amazing. God, that's wonderful.
well,
No, but it
isn't
takes
that cool though? Because
but it takes that
'cause they wanted
experience
to do a
though.
C-section.
It takes that experience to really be able to help people like that. I mean, as a chiropractor, there's so many of you out there, but then I've gone through so many of you to find you, because it's not that they don't know what they're doing. It's just that there's specifics that you need to be aware of in order to truly help somebody medically. I mean, you can't
Right.
really just go in there and adjust the neck and adjust the back. Okay, you're done. Bye. No, you got to know what you're doing, and obviously you do. So,
Yeah.
but
Well, thank
so
you.
we were talking about the vagal system. So then the vagal system
Yeah,
is such a long corded nerve that it's supposed to be my friend, but I guess my body doesn't like him, and they're not getting along.
Sort of, I guess. Just like every part of the car, you need that part, and just because it's not working right, it doesn't mean you don't need it, right?
Oh, I need it, but I need it to work together.
Yeah, that's true, and that's all it is. And so just like you need a good mechanic to get in there and kind of retune things and get it working efficiently. You got a great Ferrari there, Bianca, and just
I'm
needs
a
a
Ferrari,
tune-up here
people.
and there. That's right. Exactly.
That's awesome.
I think we all are.
We are. We're all these fancy cars, but we just need to take care better of them instead of just watering it and wiping it down. But it's necessary. I know that the vagal nervous system has been causing me a lot of problems, but the adjustment you made did give me a little bit less of the achiness in my neck, where the mastoid process is in the back, where the occipital cranial part of my head is. So that part was right behind the ears in the sternocleidomastoid, which is that big muscle that comes down your neck to your front. Well, the top part still is a little achy, but it's not as severe as it was a week prior. So that makes me feel good.
Wow. Well, awesome. That's a start. And I knew that like you said, that we didn't want to overstimulate by, trying to adjust everything. And so again, we had to be very careful about which one we chose to adjust, and we did. And so, yeah.
What is the purpose of the vagus system anyway, though? I'm sure people don't understand what that is. What is the vagal nerve? What does it do?
Well, it's going to regulate part of the parasympathetic nervous system. Remember, you have 2 different parts of your nervous system. You have what we call the central nervous system, which is your brain, and then the spinal cord. Then you have what's called your autonomic nervous system, and that's broken down into your sympathetic and your parasympathetic. Yeah, your sympathetic, of course, is when you have that fight or flight syndrome, they call it. And then the parasympathetic is the rest and the healing phase. And those are the things that are more the subconscious acts that are happening. Like when you're sleeping, you don't have to tell yourself to breathe. Like when you're up and you want to grab something, you tell your brain I'm going to grab this, then it does all that, all right?
Right.
But when you had that lunch today, you didn't have to tell your body how to digest. That's part of your nervous system just doing all of these things automatically. And so, that's part of that vagus system or parasympathetic system as well.
Wow. So I guess what I would like to say is regardless of what the condition may be, the spine is an important hub for a lot of the communication factors from the brain to the body. So obviously getting stuck or in a bad position can cause all sorts of havoc to the organs as well as the way you feel temperature-wise. Or because I was telling you before, I get the nerve flu, especially when there's overactive areas, especially my neck gets really hot. So it could just be that I need an adjustment or need to manipulate the muscle area to relax.
Yeah, exactly. My kids are they're older, obviously. They're adults now and stuff. And whenever they feel anything, they always say, "Dad," and they come in for an adjustment. And, my kids are hardly ever sick. I mean, my daughter, my daughter's 41. She'll be 42 in a few months. And my son's 38. My other son's 36. Do you know, I think they still have not taken an antibiotic yet.
Oh, wow.
Or if they have, it might have just been a thing here or there. But whenever they get sick, literally, like instead of a flu lasting 10 days or something, for them, if they feel something coming on, it'll last, and they come in and get adjusted, it'll probably last for maybe 2, maybe 3 days at the most.
Yeah, that makes sense. It does make sense to me, though, because that is, if their spine is well aligned, then obviously they're not going to have off-balance communications in their body system. So that if they have something bad or foreign, they can fight it faster.
Exactly. Yeah, and it fights it off so effectively. I mean, it really, really does. And, just amazing how this body works. Like I said, the nervous system is the immune system, and the immune system is our nervous system. It goes hand in hand. And so when that's working great, the body can heal great.
So what would you advise people to do to avoid having to come see you as often? Or if they do come see you, how would you advise them to live a healthier lifestyle so that your adjustments actually stick?
Yeah, stick, yeah. There's just a couple things that are so important. I think our food is the greatest thing right there.
Right.
If you put the right fuel in a car, I remember when I put the wrong fuel in my car one time. Oh, it ran terrible. And it's the same thing with the food that we eat. And, because our body has to have food that gives life, not just tastes good, but gives life. And some great water, great breathing, and great movement. Just like a car was designed to drive and a plane was designed to fly, our bodies were designed to move,
Right.
And if a plane doesn't fly or a boat doesn't sail or a car doesn't
rusty.
drive for a while, it just sits there, it just starts to break down faster. And so same with our bodies, when you get too lethargic, and that's what I'm noticing with this COVID thing, a lot of people weren't being as active. And so I'm getting quite a few people with a lot of things going on that shouldn't be. And I just call it life exercises. You don't have to be a member of a gym, although it'd be great for, have somebody like you, to help us along, right?
Yeah, I mean,
but
how many people don't like you? They don't know to go to you. They don't know to call you because they don't know you exist. One. Number two, they don't know how much of a help you can really be because they go to their regular doctor and they think their doctors have all the answers for everything, and it's not the case.
Right. Exactly. Yeah. Yeah. So, I kind of think of myself as that doctor. If you come to me, I don't have no drugs, no surgery.
Exactly.
And you come to me, what do you do? And that's where I come into play. I've been on medical mission trips and where, I've been able to help some amazing people with some amazing things. And, I don't have all these fancy things there. Not that I give drugs. I don't,
Right.
But, I was working with a buddy of mine who's a medical doctor, and, he's kind of limited in what he can do. But what I can do, I change something different in the body, and I help that body communicate effectively. And when that body can communicate effectively neurologically, amazing, amazing things begin to happen and heal. And I've seen it many, many times.
Well, that's pretty crazy. I can't, something as, I don't want to say simple because it's not simple to be a chiropractor, but something as, I don't know, simple as adjustment, let's say, can make the huge difference versus having to take a pharmaceutical. And it's not the same you don't take one, but I'm just saying when it's merited, right? I try not to take pharmaceutical medication unless I absolutely have to take it because I don't do well with medication. So I have to find
Right.
the alternative route for my body.
Right. I just had a patient in today, a gentleman who's 48, and he's been pretty much down for about a year. He couldn't do a whole lot of things. He went through that whole route of, painkillers here, painkillers there. And I've been seeing him now for about a month now, I think. I mean, this guy's back to surfing, just doing all kinds of things. But he made a comment today. He's, when I said, "Are you still doing good?" And he says, "Man," he says, "this has been life-changing for me, And I hear that term a lot sometimes. I mean, because I've heard that term from other people, that it has literally changed their lives,
Oh, yeah. I can imagine.
So,
And when I say
yeah,
that...
and again, it's not me. I don't do...
No,
yeah,
your technique does make a difference, though, sir.
But I help, yeah.
You're more skilled than you're telling people. I mean, seriously, the number one thing that I noticed about your first visit is that you are very attentive and listening. You're not distracted. You're paying attention to what I'm saying. And I can see the light bulbs going on in your head. And I can tell that you're thinking, oh, gosh, he's really messed up. But no, you're not saying that. But yeah, because you're ethical. But you realize that there are things that you can do. You know what you can do. And you're honest about what you can't do. And you try to put something together that would make me feel at ease. And I think that's a big part of being a very good doctor. And I think the second part is getting the results, and you've obviously gotten both.
Wow. Well, thank you. I appreciate that.
Yeah,
I'm always
absolutely.
humbled when I hear.
Yay! Aw. But I do know that you have your clinic, and that's in Evelay. Where exactly your? I think it was by.
Well, it's not. Yeah, it's not actually in Evelay. It's in the Liliha area.
Yes, I'm so sorry.
I think a lot of no, that's okay. No worries. I think a lot of the local people will know the original Liliha Bakery, and that's they're my landlords actually. So I'm right behind them, and I am actually right above the kitchen area.
There you go. Hey, this is perfect.
So every once in a while, it comes up the smell for me.
Listen,
really
instead of giving people a lollipop for being a good patient, you can give them a donut.
Give them a donut.
This is bad for me to say. I'm a trainer. I shouldn't be saying things like that. That's bad.
I know, but that's okay.
And so your name of your business is Garza Wellness Care Center, and you made it more of a clinic than is just a chiropractic office. So what else do you guys do in your center? Besides
we do some nutrition as well.
Okay.
Yeah, we do some nutrition as well. We help them with that, and so that's one of the other things we do. One of the things I do as well is an allergy protocol that I do. And in fact, I just had a girl here yesterday, another patient who was blown away, when we did this allergy protocol on her. And I think it had been almost a month since I seen her, but she said, that thing you did for me? I said, yeah. She says, as soon as she left, she realized it was different. And she did not have a problem since. And so,
nice.
I do stuff like that, there's so many things. I mean, I can do that. You'd be kind of surprised, I think, especially like things like acid reflux or women with menstrual cramps and just a whole host of things. And
well, it makes sense. Like I said, you're helping the body communicate better, and being the spinal column being the hub of the nervous system from the brain to the body. I mean, that's what you're helping that communication. So that makes sense to me. So Dr. Garza, is there any last thoughts that you'd like to share before we say goodbye and wish you a Merry Christmas and all that good stuff, because that's coming up?
Oh, yeah, we can. There's a great saying that we have in chiropractic: the power that made the body heals the body. There's no other way. But that body has to be functioning as best that it can, because when it can communicate effectively, it will heal effectively. And boy, I'll tell you, this life of yours can be so much more effective. You can live your dreams out better, your goals out better. And, I've seen it happen many times where people, like that one gentleman said, it's life-changing. And so just appreciate you giving me this time.
Well, listen, you're awesome. Thank you for giving me your time. I know how busy you are, so God bless you, and thank you so much.
Yeah. You're so welcome. But yeah, I can see already my patients are already coming.
Yeah,
in
they're
here
lining
now,
up.
so.
Listen, they know what's good. They're waiting to feel good now. So thank you, Dr. Garza.
Well,
I know
that.
that I will see you soon. I've already made my appointment, and I will be there with bells and whistles and my tail wagging. But you take care, and I will see you soon.
Okay, and you too. Merry Christmas and to all the
and
people
Happy
out
New
there
Year.
as well, and
Yes.
to you.
Yes.
And Happy New Year's as well. Take care now.
Okay, thank you, sir. And everyone, I just want to say thank you for being on the show here, listening to all of us having a good time as usual with Dr. Garza. And please check him out. If you guys want to know more, you guys can check my YouTube page, Be Fit for Health, and that has all the videos from the past shows as well. Then you can go on there and re-listen to the show as well. But yeah, definitely reach out to me at befitforhealth.com. The contact page there. Send me a message and I'd be quick to respond within at least 24 hours. And if you guys really need to learn a little bit more about what some of these opportunities that I presented to you this past 2020 were and who these doctors are, definitely reach out to me, guys. I'm very accessible. I really want to make sure that, the purpose of the show has always been to bring you information about what the options are out there. And, this is a selfish journey that I'm taking, and I've always been honest about it. I've always wanted to learn more about the human body, and I get these incredible doctors who are giving me their time, and I get to pick their brain and ask questions that I can't normally ask them because they're too busy. And so your guys are benefiting from this, and I want you to know that this journey of mine is going to be the same purpose and the same intensity when it comes to really finding the answers to what we can do to keep our body in balance and pain-free. Because, like I said before, I really don't wish any of you any of the experiences that I've had to experience the past 15 years of my life. And that's been, irregular heartbeat to, muscle pain to cramping in my neck. Can you imagine? And cramping in my stomach because my spine is not properly communicating with the brain. So the brain is, sending wrong messages, and the vagal system that I was talking about has been overly stimulated and things aren't communicating right. So I'm getting the brunt of it and having this pain. So I really want to avoid those things, but I also want to avoid it for you guys. So a lot of you may not know the human body as well as I do, but I do know that if I can give you this information, you may take it to your doctor. Your doctor may have a solution or refer you to someone. I'm referring you to some of the doctors that came on the show. Look them up, go see them, and see if they can help you in any shape or form. But listen, guys, I appreciate, your time, and I appreciate you listening to the show. And, if you need me for personal training advice, if you need me for nutritional advice, if you just need me for a healthy living lifestyle advice, reach out to me, like I said, at befitforhealth.com, and I'll do my best to help you as much as I can. Well, that's it for today. I wish you a great day. I hope you guys have a great, wonderful rest of the week, and I will talk to you again next week about your health and wellness. Take care of each other, yourselves, and aloha.